Hello, I'm Ella, and I'm a play therapist registered with the British Association of Play Therapists, known as BAPT. Play therapy is a well-recognised therapeutic approach specifically tailored for children and young people. Play therapy harnesses the therapeutic potential of play to create a safe and supportive and non-threatening space for children and young people to explore their feelings, experiences, and challenges. By engaging in play and creative activities, children and young people can express things that they may find too difficult to put into words. Sometimes the child or young person may reenact aspects of their life through interacting with the toys and creative activities. This can feel more manageable for them, as they perhaps play out specific traumatic events or difficult experiences, which can help them to process and resolve issues, enable healing, and aid them to develop the skills to cope. Play therapy is child-centered, allowing the child or young person to take an active role in the therapeutic journey, where the play therapist comes alongside them and guides the child or young person through the process, providing support and understanding. In a school setting, play therapy sessions may take place once a week for about 50 minutes in a designated, private and welcoming space, where the child or young person feels comfortable and safe. The play therapist provides toys, arts materials, sand and other creative resources to encourage emotional expression and exploration. Play therapy has been proven to be effective in addressing a range of difficulties, such as emotional struggles which may manifest as changes in behavior, difficulty expressing feelings, or withdrawal from social situations. Traumatic experiences or losses may leave lasting emotional imprints that play therapy can help address. Behavioral challenges such as aggression or anxiety may be indications of underlying emotions that play therapy can also deal with. However, there are times when it may not be helpful to start play therapy. Since play therapy gives children and young people the opportunity to explore their deepest and most traumatic feelings and experiences, it is not appropriate to expose them to this if they are not physically and emotionally safe enough, or if there are lots of ongoing changes, for example, moving school or home. There are a range of benefits of play therapy in schools. For example, improved emotional regulation. Play therapy helps students learn to identify and manage their emotions effectively, leading to better self-regulation and reduced disruptive behaviors. Enhanced social skills. Through play, children and young people can practice social interactions, improve communication, and build essential social skills that foster positive relationships with peers and teachers. Academic performance. By addressing emotional and behavioral challenges, play therapy can positively impact a student's ability to focus, concentrate, and engage in the learning process. Reduce stress and anxiety. Play therapy provides a safe space for students to release stress and anxiety, promoting a calmer and more focused learning environment. Conflict resolution. Play therapy helps students develop problem-solving skills, conflict resolution strategies, and healthier ways to express themselves. A common misconception is that a play therapist simply plays with the child or young person. Although play therapy involves unstructured play, it is far from just free play. The therapist is actively involved and comes alongside the child or young person during the sessions, observing their play and coming to understand the meaning behind the play. The play therapist learns about the child or young person's emotional world and guides them through the process using various techniques to facilitate emotional healing and growth, to help the child or young person work through their trauma, grief, anxiety, or behavioral challenges. Although play therapy is primarily used for young children aged between 4 and 12 years old, adolescents can also benefit from play therapy. Unlike traditional talking therapies, which adolescents may be more resistant to, the use of play and creative activities can help young people express themselves in a non-threatening manner. Play therapy is at times thought to only be for children or young people with significant psychological and emotional issues. However, play therapy can also benefit children and young people with a wide range of challenges, including everyday stressors, social difficulties and withdrawal, emotional and behavioral regulation difficulties, low self-esteem and self-worth, and developmental difficulties. Another misconception is that play therapy can be a quick fix or an immediate solution to emotional or behavioral problems. However, play therapy is a process that can take time, as healing and growth often requires ongoing sessions to build trust, facilitate emotional processing, and address deep-rooted issues.